We summarized our approach both to analysis and to the recommendations by looking first at structural drivers of inequalities: economics, colonialism and racism, environment, climate change, environment. Second, the conditions of daily life through the life course. And thirdly, governance and human rights mechanisms. And so in each of those areas, we have 12 domains, and we have detailed recommendations based on the evidence that we collected. So we think when governments take our final report, they can deal with inequities in power, money and resources. They can deal with the conditions of daily life. And we've given examples of governance and human rights mechanisms that will deal with health inequities. Social Determinants of Health runs right through this PAHO Commission, no question. But we've done some things that we didn't do in the Global Commission. The importance of colonialism and racism, which relate, of course, to ethnic differences. We've said much more about environment, and that's climate change, but it's also resource utilization that impacts on the lives of Indigenous people. It's recognizing the relationship of Indigenous people to the land. We've done much more on human rights mechanisms than we did with the Global Commission. And then there are issues like violence that we didn't say a great deal about in the Global Commission, but it's something that every country in this region is concerned about. So there were different approaches that we took. I'd like to think that we learned new things, and that indeed will feed back into other parts of the world. Fundamental is that every country has to put equity at the heart of all government action, whether it be education, the environment, working conditions. Put equity at the heart of all action. And if you do that, then health equity will be at the heart of all government action. Now, that's what individual countries can do and should do, and that we would like them to do. So we want to work with countries to develop real practical action, to take the report and say, how can we do it in Bolivia, in Colombia, in Brazil, in Guatemala, in Jamaica? How can we do it in our countries? But it also means there's got to be action at a supranational level, because countries' ability to control their own destinies is very much influenced by what happens at a regional, supranational level. And PAHO can be the advocate for a more just distribution of life conditions and for greater health equity.